Given the growing impact of antimicrobial resistance, improvements in diagnosis and treatment of the most common outpatient infection, urinary tract infection, are of great interest to stakeholders. Regulatory authorities have long accepted a microbial threshold of 10 to the 5th colony-forming units per ml as the standard for diagnosing UTI based on standard urine cultures. However, microbial thresholds considered clinically relevant remain in dispute. The aim of this systemic scoping review is to assess the evidence supporting a threshold of 10 to the 5th colony-forming units per ml, to review microbial threshold guidelines, and highlight knowledge gaps in the diagnosis of UTI. A total of 36 guidelines containing 144 recommendations were identified, with 64% of the guidelines, N of 23, and 58% of recommendations, N of 83, published the last 6 years, between 2016 and 2023. Recommendations have changed over time and across variables, including the geographical location of the guideline, urine specimen collection method, patient sex, and category of UTI. Guidelines uniformly agree with suprapubic needle specimen collection. However, there was no consensus for midstream collected urine samples. Guideline microbial thresholds for clinical UTI diagnosis were higher for women at average risk, at 10 to the 5th colony-forming units per ml, than for men, ranging between 10 to the 2 to 10 to the 5th colony-forming units per ml, and high-risk patients, ranging 10 to the 2 to 10 to the 4 colony-forming units per ml. Guidelines relied heavily on 48 research articles from 20 author teams published between 1956 and 2019, and recommendations frequently cited 23 research articles by 15 author teams published between 1956 and 2013. Evidence supporting 10 to the 5th colony-forming units per ml threshold originated in the mid-1950s from 4 research articles, whereas 18 frequently cited peer-reviewed publications focused their research on clinical relevance of lower threshold, from 10 to the 1 to less than 10 to the 5th colony-forming units per ml. This review demonstrates a lack of consensus for urine culture microbial threshold recommendations for the clinical diagnosis of UTI. Guidelines are primarily based upon sparse and dated evidence. Additional research is needed to inform clinically meaningful diagnostic microbial thresholds in the diagnosis of UTI.